The perineum is a significant anatomical region located between the thighs and buttocks, extending from the coccyx to the pubis. It includes a shallow compartment beneath the surface, situated inferior to the pelvic diaphragm. The uvula encompasses several structures: the labia majora and minora, the mons pubis, the clitoris, the vestibule, and the ducts of glands that open into the vestibule. The labia majora are external skin folds with underlying adipose tissue. They contain hair follicles and glands and fuse anteriorly with the mons pubis and posteriorly at the perineum. The labia minora, narrow skin folds without hair follicles or adipose tissue, contain sebaceous and sweat glands and merge with the clitoris at the prepuce and frenulum. The clitoris is the embryological equivalent of the penis and comprises two crura and a glans, with the frenulum located on the ventral surface. The vestibule, found between the labia minora, is bounded by the clitoris anteriorly and the perineum posteriorly. It includes openings of the urethra, vagina, and the ducts of Skene's and Bartholin's glands. Bartholin glands, located at the vestibule, are crucial for providing vaginal lubrication during sexual arousal, aiding in comfort and function. The uvular muscles, including the superficial transverse perineal, bulbocavernosus, and ischiocavernosus, are positioned superficially to the fascia of the urogenital diaphragm. They play a significant role in supporting the pelvic floor and are supplied by a network of blood vessels and nerves. The vagina is lined with the stratified squamous epithelium and surrounded by three smooth muscle layers. Beneath these layers, a submucosa rich in veins and lymphatics supports the structure. In cross section, the vagina appears H-shaped and maintains stability via the tendinous arc of the pelvic fascia. The cervix forms an angle of 45 to 90 degrees with the vagina, which is divided into anterior, posterior, and lateral fornixes. The hymen partially obscures the vaginal orifice, while the vaginal artery, a branch of the internal iliac artery, provides the major blood supply. With aging and childbirth, the connection between the vaginal walls and pelvic musculature may weaken, potentially leading to decreased stability of adjacent organs, including the bladder, rectum, urethra, and uterus. The external os of the cervix is round in women who have not had children and transforms into a transverse slit after vaginal childbirth. The scamocolumnar junction, or SCJ, is visible during the reproductive years but recedes during menopause.